disorders. So important point to understand in the intracranial dynamics, it is associated a balance of multifactorial system that includes the brain tissue, the vasculature, the cerebrospinal fluid, and any kind of mass region either due to tumor or any kind of hematoma. So the first thing to understand is that cranial vault is a fixed structure with a very delicate balance between the brain tissue, the vasculature, the CSF. So the Monro-Kelly doctrine indicates that if there is any kind of expansion of any of this system, there will be compression or decrease in the size of the other system. So basically, if there is any kind of hematoma, it will lead to compression of the brain tissue. If there is edema of the brain tissue, there will be decrease or it will compress over the vasculature. So that is how the Monro-Kelly doctrine, it regulates the various physiological changes occurring due to various factors. If it is the brain tissue, there will be edema. So it can be either due to cell damage, that is cytotoxic, or it can be due to vasogenic, or due to neoplastic, or can be inflammatory. So we need to reduce the fluid which is getting collected in the intracellular space by removing in the extracellular space with the help of diuretics like mannitol, furosemide, hypertonic saline, and also we give steroids to reduce this perineoplastic or inflammatory vasogenic edema. So important point to understand is that steroids are used for decreasing the edema in perineoplastic and in cases of inflammatory edema. So that is what is important to understand. Coming to CSFs, I've covered the route from which along the ventricle CSF flows in the video from Bailey. Now, if you see the CSF production, it is occurring at the rate of 15 to 20 ml per hour from the choroid plexus. Now, any pathology which affects the normal transport, so it can be either due to communication or due to any kind of obstruction, there will be increase in the CSF pressure. But the rare exceptions wherein it is not due to this is in cases of choroid plexus tumor where there will be excess secretion, and in ventriculitis where there will be decreased production. So that are the exceptions how the CSF pressure increases. So as I told, there will be impaired absorption, any kind of post-infectious syndrome, communicative, obstructive, or rare exceptions. How do you treat it? So you treat by drainage, either by externally or internally. Externally you do by ventricular drainage, internally you do by VP shunting, or newer methods are endoscopic fenestration and third ventriculostomy. And you can also use medicines like acetazolamide to decrease the production, and steroids both help in decreasing the CSF production temporarily.